Hi, welcome. Welcome. Hi, how's everybody doing today? My name is Dr. Ravin Milton, PharmD, and this is another episode of RX Info on the Go. So, do me a favor. I ask this all the time, and I'll continue to ask it. If you could like, tag, and share, I'd appreciate it. If you could please like, tag, and share. Tag somebody who needs to know something about aloe vera and what it can do for you. So that's going to be the topic for today is aloe vera. So if you'll take the moment to just like, tag, and share. Also, while you're at it, go ahead and follow all of my different media platforms. So Facebook is going to be the business page, Dr. Raven PharmD. If you could follow that for me, and then my YouTube channel, if you could subscribe to that one as well. And then you can follow me on Instagram as well as TikTok. So I'm on all of those platforms, and you'll get a notification of whenever I go live so that you can get this information that you never knew you needed. Ha! All right. So our topic for today is going to be aloe vera, and I think it's a very interesting and timely topic because aloe vera is used for quite a few things, but mostly we know it for like the benefits that it has for the skin and burns. Um, and it's the summer, so people are getting sunburn like all the time now. So aloe vera is going to be the topic for today. Just go ahead, like, tag, and share. So here we go. Now, aloe vera is made from the aloe plant. It actually goes by several different names, but we know aloe vera as the most common name of that particular ingredient, is what we'll call it. So it comes from the aloe plant, which is like a cactus-like plant. And I don't know if you've ever seen it before, but when you get it straight from the plant, the leaf itself is what has all of the good stuff in it. And when you soak that leaf in hot water, you can peel the pretty much the skin back off the leaf, and it'll leave you with like this gelatinous material that's on the inside, and that's all the good stuff of the aloe that does all the good stuff for you. Aloe vera has so many good properties, and we're going to talk about that in just a second. So, it is cultivated in Florida, Texas, and Arizona in the United States. So, that cactus like plant that needs those hot temperatures, and you're sure to find hot temperatures in Texas, Florida, and definitely Arizona. So there are over 360 species of the aloe plant, which I thought is fascinating. And it is commonly used in cosmetics and medicinally, and it has been used that way for quite a long time. So, and medicinally, it is used both orally and topically. So, here we go on that. That's just a brief overview of aloe vera. Here goes the rest of the information that you really need. Now, it can be used for several different things, and y'all, the list of what this can be used for is kind of like blowing my mind. So the top thing that came up was acne. It helps to reduce the lesions when used with tretinoin. So there's a product called tretinoin that is specifically used for acne and helping to, get rid of those lesions and bumps and things like that. And you can use it with the tretinoin. Um, Typically tretinoin does have type of a burning sensation that happens sometimes. It doesn't happen to everybody, but it can feel like it's kind of irritating the skin. And aloe actually helps, has a cooling effect, so it can help in that manner. It helps to cool and rejuvenate the skin. So that's one thing. That's the aloe gel that will be used with that. Now, I talked about sunburns. Aloe vera or aloe vera gel can be used for burns as well. It can be used as a topical aloe gel or cream, actually, and that reduces the healing time, which is a really good thing. So, a lot of people will use 100% aloe vera gel on their sunburns, or there are actually a lot of sunburn products out there that have aloe contained in them, and that's just because it helps to decrease the healing time as well as soothe the skin. That's going to be in Superficial burns, so we're not talking about those major burns. We're talking about a superficial burn like a sunburn, or possibly even a kitchen burn that's like right on surface level. Constipation. Now, there is this thing called aloe vera juice. Um, Aloe vera juice will indeed help you go to the bathroom, but it is not marketed for constipation. Why? Or it's not marketed as a laxative. And the reason why it's not marketed as a laxative is because the FDA actually banned the use of oral aloe latex. So there are different forms of aloe. Remember, aloe vera is just one of them, but oral aloe latex is a pill version of it, and that particular one is not supposed to be used for constipation. It's not supposed to be used as a laxative. Now, the FDA has said that's a no-no, but we all know that aloe vera juice kind of has that property in it. Anyway, there are drinks out there that are made with aloe vera juice in it, and if you have just a little bit of it, it can cause some of that laxative effect. Are you supposed to use it for that reason and that reason alone? No, but it can have that as a side effect. So that's one thing. Now, diabetes, this one I actually found interesting because I didn't know this about aloe when it comes to diabetes. The oral aloe may reduce blood glucose and A1C in diabetic patients. This is something that they've actually shown that it happens. So we just want to be careful, of course, when you are taking anything else that's over the counter, any type of supplements, and you are seeing a physician you're under that physician's care for any reason. You want to make sure that you run these things by them. So I did not know that the aloe vera actually has a positive effect for diabetics. This is oral aloe that may reduce blood glucose and A1C levels. So now there is another thing that I did know. We don't see it talked about much because it is a prescription version, but there's a prescription version out there of aloe vera that is used specifically for genital herpes. It is a cream that is made with aloe vera, and it's an extract cream, which pretty means it's a high percentage of aloe, and it helps to improve the healing of the genital herpes lesions. Now, when we're talking about genital herpes lesions, we're talking about the lesions that are on the private parts, and those areas are a little bit more sensitive. So aloe gives that cooling effect. It also gives the reduced healing time, so it takes shorter time to heal, and the extract is what is used in the prescription product. I can't remember what the brand name of the product is, but it is available as a prescription. You would think aloe being over the counter, why would it be, used as a prescription? Well, it's treating a very sensitive area for a very sensitive thing. So that's that. And then, of course, psoriasis. Now, we have talked about it being used topically, so it would only make sense that it might actually help soothe the skin and reduce lesions from psoriasis as well. The topical aloe extract cream may reduce the redness and scaling that's associated with psoriasis. And that's actually makes sense. It makes sense that it would do that. So not all aloe vera gel would have that same effect on the psoriasis. That is something to keep in mind. The aloe vera gel itself versus the aloe vera extract or aloe extract cream, it's a difference in the formulations, which means this is a difference in effect. But the extract cream will help for psoriasis, whereas the gel can help for like burns. Now, as far as the dose is concerned, these are all products that are typically marketed with directions on them. You want to use the directions that's on the actual package because it's a topical product and it's not really something that has a set direction for it, especially with aloe vera juice, the aloe vera extracts, the aloe gel, raw aloe leaves. They're all used in different concentrations, different formulation, different amounts that you will be taking. So it's pretty much going based off of the product that you have in hand and the directions that are suggested on that package. Topically, it's available as a gel, a cream, a vaginal cream, a patch, even toothpaste and mouthwash. Again, all of those products, you want to use it as it's directed on the actual package. Now, it is safe for children when you're using it topically as a gel, the cream and the mouthwash actually, in a topical solution. So you just want to make sure that when you are using it with children that you are using exactly as it's instructed on the package. You don't want to do it any other way. Side effects that can occur with aloe would include for oral aloe. So the oral aloe latex, that particular version formulation can cause diarrhea. It has the greatest adverse effects of all of the different types of aloe that's out there. Aloe vera, you really don't see as much side effects. You know, of course it does if you're doing an aloe vera juice. Most of the time those juices are not 100% aloe vera juice. They are kind of like a mixture. So you do have that effect of going to the restroom, but you don't have the effect of it being like an actual laxative. If that does happen, it's possible you've either drank too much or something else is at play there. So oral aloe latex can cause abdominal pain, cramps, and diarrhea. And topically, even though it is for burning, sometimes a person may be allergic to aloe, and then it would indeed cause burning and inflammation and itching if that person is allergic to aloe. It happens. I know people who are actually allergic to Benadryl, and Benadryl is supposed to be the one thing that you take when you are allergic to something. It absolutely happens. Let's see. So for drug interactions, if you are a heart patient that's taking digoxin, you want to stay away from aloe vera products or aloe latex, actually. You want to stay away from aloe latex oral products if you are a digoxin patient. That is a medication for the heart. And if you are on it, you want to make sure you are staying away from aloe latex capsules. Any anticoagulants, if you're on warfarin, Eliquis, Xarelto, things like that, you want to stay away from the oral product as well. It can increase the risk of bleeding. Any supplements that you are taking that have an anticoagulant or antiplatelet effect, any supplements that would cause you to bleed or would cause you to thin out your blood. So say aspirin. We don't think of aspirin as a supplement, but it's available over the counter. If you're taking aspirin on a regular basis, you want to stay away from oral aloe. It will cause you to bleed more. That goes for any herbs that might actually cause that same effect, the same anticoagulant, antiplatelet effect. So cardiac glycosides, this is something that that would contain our cardiac glycoside containing herbs. I said that wrong. Cardiac glycoside containing herbs. Those will interact with aloe as well. Horsetail, that's another supplement that I really don't hear that much about, so I'll have to do some research on that for you and bring that one as a topic. Licorice, we all know about licorice. And then stimulant, laxatives, herbals. So we're talking about your Senecot, things like that. You want to stay away from aloe while you're on those products. What happens with this is that because it has a laxative effect, it actually causes the potassium to be depleted. And in a heart patient, that's actually not a good thing. So if you're a heart patient, you want to stay, try to stay away from aloe as much as you possibly can, because if you're taking it orally, you can have those potassium depleting effects, and that can trigger a not great response of your heart. It's the best way to put it. So interactions with conditions, I just talked about heart patients. If you are someone that typically does have GI conditions, if you have and you're taking it orally, you would not want to take that. It can, make your GI condition worse. If you are doing it orally, that's where you're going to have the majority of your side effects and your contraindications and your, not being able to combine two things. If you're doing it topically, you should pretty much be fine. Aloe is not something that goes systemically that way, to the point of you having a major interaction because you're applying sunscreen and you have a GI condition. Yes, it's not how that works. For people who have kidney disorders, because of that potassium depletion, you want to make sure that you're staying away from the oral aloe as well. And if you are having any type of operation, you want to make sure that if you're taking the aloe pills or aloe latex, you discontinue them at least 2 weeks before your surgery, because again, it can cause you to bleed. So that is the major things for aloe. The key to aloe is that the leaf is the source. The leaf is the source of what you're going to make those products with. I've even seen people using aloe for their hair. As a matter of fact, I just watched a video on YouTube not so long ago where a girl took the aloe leaf and, broke it down, heated it up, and made a gel and applied the gel to her hair. It was pretty cool to watch. And so it actually helps your hair grow. And I've seen a few people do that. I actually have a friend of mine I've seen do it. And then also, if you're doing the oral aloe, using it on a short-term basis is best, not a long-term basis. You want to do it no more than like 42 days or 6 weeks. And that's going to be about it. There's a lot of information on aloe. I'm pretty sure if you have not seen aloe vera juice or aloe capsules, aloe latex capsules, you could Google it. You'll see a whole bunch of stuff come up. It's available in many formulations. If you have hydrocortisone at home, I'm pretty sure you've seen the hydrocortisone with aloe because it helps to soothe the skin for irritations. It's a pretty good product. pretty good product. And I just want to encourage you to learn just a little bit more about it. Make sure, of course, always my disclaimer, make sure that you are seeking your doctor for any supplement that you take. You want to talk to your doctor or your pharmacist. Any supplement that you take, you want to talk to your doctor or your pharmacist before taking it, especially if you have health conditions. Especially if you're on different, medications, to make sure that you are reaching out to someone before starting therapy yourself. I know sometimes we don't want to go to the doctor. Sometimes we don't want to actually talk to people about certain things. We try to handle it on our own, especially, in a time when people don't have insurance. But please talk to someone. It is free to send me a message on Messenger or any of those other outlets, but you can contact me and I'll answer a question for you. I have no problem doing that. Also, if you could please go to my website, www.drravinpharmd.com. I'd appreciate it. Subscribe there. I've been saying I'm working on a blog. I am. I promise y'all, I am. I'm trying to get some stuff done. And I'll have some stuff coming to you as soon as I possibly can. I thank you for watching and just, tuning in every week. You don't have to, but you do, and I appreciate you more than you know. It encourages me to keep going and to continue to put these videos out for you, to give you information that you need. And sometimes it's information that you don't need, but it might be information that you don't need, but somebody else needs, and you can point them to my direction. Also, if you are looking for someone to go over your medications with you, to review all of your medications, I do pharmacy consultant work as well. You can always reach out to me and go onto my website and schedule an appointment with me as well. If you have any questions, hit me up. If you want to suggest a topic, hit me up. If you want to just share some information that you have, hit me up. Let's talk about it. All right. I hope y'all have an amazing day and happy Wednesday.